One of the most important things to come out of the Clinton Global Initiative has been the mountain of evidence that what really works in the modern world is partnership. It's a fact that diverse groups make better decisions than homogeneous ones or lone geniuses. That's because we learn things from people who know things we don't and who may view the world differently than we do. You start seeing some amazing things, like a movie star with a passion for giving back, joining forces with a sanitation engineer to form one of the most impactful clean water NGOs in the world. Or the trade organization that represents laundromats across America, teaming up with my foundation's Early Learning Initiative to encourage parents to read with their children while they wait for their laundry. The model works. More than 10,000 organizations have been part of the commitments to action made at CGI. And now the idea that working together beats going it alone is taking root well beyond our CGI community.
Please welcome to the stage RAGINA ARRINGTON.
Good afternoon, everyone. Whew. We all had our snacks. Did we eat? We're getting our energy. You ready for some great pitches, conversations? Yes. All right, thank you. Yes. Okay. Welcome and thank you for joining today's Greenhouse Health Equity session. So CGI Greenhouse is designed to help drive innovation as part of CGI's broader goal of unlocking new solutions and scaling current solutions to address global challenges. CGI Greenhouse has been designed to help drive innovation as part of CGI's broader goal of unlocking solutions. Excuse me, that's written twice. It's also a space inspired by the work of Clinton Global Initiative University, or CGIU. And I am the CEO of CGIU, and we have a lot of CGIU people in the room, and I have the distinct privilege of working with a diverse community of current students tackling pressing challenges worldwide. Since President Clinton founded CGIU in 2007, we have helped and worked with more than 12,500 students from over 1,800 different countries, 1,800 different schools across 160 different countries and all 50 US states. And we have participated in the community of learning, leadership, and action. Our students and our program alum are passionate self-starters who push boundaries and commit to take action. It's my pleasure to see some of our rising leaders participate in CGI Greenhouse, such as Sam Warwick of Next Step Health. This space provides connection and collaboration. Over 230 companies were nominated by members of the CGI community, and a cohort of 30 social entrepreneurs from around the world were selected across issue areas and were chosen to participate in this programming. So throughout the annual meeting, we have hosted multiple sessions in which 3 of the sessions are organized by our CGI content pillar areas. These sessions will highlight startups within each of the pillar areas of inclusive economic growth, climate resilience, and the one that you're in today, health equity. Today is our final 5th session of the annual meeting. The key goal of this space is to offer the social capital needed to grow, to introduce innovative technologies and business models, and to connect and support entrepreneurs to maximize CGI meetings experience, and to, of course, better integrate with the broader CGI community. Today, we're going to hear from 9 startups working to enhance health equity, who will present to a panel of 3 judges, whom we will hear from later in the session. And at the end of the session, judges will select one winner of each of the 3 Greenhouse pitch presentation sessions that will be announced during the closing main stage session this afternoon. Also, as a result of a gracious gift by entrepreneur Kevin Hsu, who some of you may have heard from yesterday morning during CGIU's session, he steadfastly supports the work of what we're doing, and 2023 marks the first year that CGI will provide prizes for our entrepreneurs in Greenhouse. That's something to cheer for. One startup each in inclusive economy, climate resilience, and health equity will receive a prize of $25,000 to be used towards achieving their broader impact and mission. And so before we move into the presentations, I'd like to welcome and introduce our distinguished guests to the stage for a fireside chat. I now welcome Dr. Chelsea Clinton, Chair of the Clinton Foundation, Joe Kiani of Massimo, and Shelly Saxena of Savimumba, one of Greenhouse cohort members, to the stage. Thank you. Hi, you too.
Hello. I really want to thank everyone actually from the audiovisual team who ensures that we are able to hear and be heard, and who also seem to just meticulously cue the music, and then whatever the opposite of cue is, turn it off, I guess. I feel like we've thankfully really lived my grandmother's admonition of the discipline of gratitude and have thanked lots of people throughout the last couple of days. And yet I don't know if we've thanked the AV people. So thank you to everyone in the back, in this room, and in all the rooms. I'm so grateful to be on the stage, particularly with my friend and someone I admire so much, Joe, and hopefully a new friend, Shelley, to hear more about their work. And Joe, I hope we can start with you, and you can talk about maybe first why patient safety is so important to you personally, and kind of how you're embedding that priority throughout the work of Massimo.
Thank you. Thank you so much. Great to be with you. Chelsea, thanks for all the work you and your family are doing. You really are a force for pure good. It's so nice. I have to give a shout out. My professor, Fred Harris, is right here. Right there, yeah. Since this is CGIU, I think you'll appreciate it. He's the one who inspired me to learn more about adaptive filters and AI and all that world that I ended up applying when I started my company, Massimo. But patient safety, one of them, of course, is that at the end of the day, we're all going to be patients. And the thought of my kids and family going to a hospital and not getting the right care worried me. But two, I think, as your dad was saying, I think whenever we think there's a problem we can address, that's our size, we got to try to. I think it's the same reason you guys keep doing this, because you can, and if you can do something, you should. And I really believe access to healthcare throughout the world should be a goal that's universal to every human being, but it's got to be safe and dignified systematically. And it hasn't been. They say to err is human, but to not have processes in place that can avoid medical errors is inhumane. And that's what we have today. Most hospitals don't have the right processes to avoid medical errors, and it is the third leading cause of death in the world. In the US, for sure. We lose 200,000 people a year due to medical errors. Worldwide, we lose 3 million. So that's why I tackled it, and I thank your dad for helping me. Without him, we wouldn't have gotten to where we've gotten to today.
Joe, maybe before we move on to Shelley, you could just share a bit more about how you have tackled that. Like what, pragmatically, are you doing to help hospitals better avoid medical errors, better detect them, and respond to them when they occur, and kind of, I know so much more that's in the scope of kind of your commitment to this issue.
Yeah, thank you. First of all, I really feel like if there isn't a solution, it's not a problem. So we took this on like an entrepreneur engineer would. We looked at it to say, what has not been done? Because a lot of great people had done work to improve patient safety, but the way they approached it wasn't working. So what did we do? First of all, we said we have to unify the whole healthcare ecosystem. It's not industry versus hospitals, because hospitals are an industry too. And everyone who goes into healthcare cares about patients. So why not bring all stakeholders in? Bring the patient families in that have lost someone. Give them equal voice. Bring in government. Bring in elected officials. And so that was important. That unification has been tremendous. I think we were, the first to do it. Secondly, we said, let's identify problems that are killing people in the hospitals. And let's then look at if any of them have a solution that could avoid it. If they do, then let's go create a checklist. Let's go make it simple. We learned from the work Dr. Peter Pronovost had done with the checklist to avoid CLABSI. And at Michigan, they did a study of it, and they saved hundreds of thousands of lives and millions of dollars. And so we implemented, we created all of those. Then we said the next part is technology isn't helping. AI is powerful, but it wasn't being deployed in the healthcare system because all the companies were walling their data. They weren't sharing the data that their products were purchased for. I'm not talking internal data. I'm talking about the measurements on your screen. It wasn't being shared. And if we're going to have AI help identify problems before it's too late, we need to have everyone share it. So we got about 100 companies to make a pledge to share their data to anyone who can use it to help patient safety. And we thought it's important to bring love to the equation. So often I heard that if you care about your patient too much, you get emotionally involved, it's bad. Well, it's not bad. I've been to places in the world that all they have is love and not a lot of tools, and they get far. So we wanted people to give love and bring the patient's voice in. So those are the key pieces we brought in. And to date, I'm proud to say about 50 countries joined. We did a commitment-based thing, just like you guys. We learned from your approach. We copied it. Thank you. And we said to everyone, if you're going to come back, you got to make a commitment. About 5,000 hospitals committed. They saved about 250,000 lives to date. And yeah, so we're still not successful. We've made progress, but we're still not at zero. And I hope one day we'll get there.
You know, Shelley, Joe mentioned kind of the hopes. I think there's still hopes, but you're getting there for kind of AI to help his work on patient safety be more efficient and ultimately kind of more effective. I know that you are using AI to expand healthcare delivery. Can you kind of share what you're doing at Sevamob and also kind of how you think about any risks, whether kind of patient safety or otherwise?
Dr. Clinton, I first want to start by saying that my wife is a big fan of your mom. And she said that the only way I'm going to travel to this conference is if I get a picture either with her or with you. So thanks for helping me.
We will try to make both those happen. I made that commitment to you here on the stage.
So thanks for helping me return home tonight by having me on this panel. So now, Sevamob, we provide AI-assisted disease management platform. And our platform has two components. One is AI-based triage, consult, and point-of-care screening. And second is health outcome delivery via telehealth and mobile clinics. In AI, our symptoms AI predicts medical conditions from symptoms. It uses large language models. Our diet AI predicts multivitamin and mineral deficiencies, and it recommends a diet plan. Our sputum AI screens for tuberculosis. Our vision AI screens for diabetic retinopathy and cataract. And our blood AI screens for iron deficiency anemia. All of this works in a last mile, low resource setting, right? So your previous question about errors and things like that, this is used by nurse or health workers. If you deploy an intervention where the nurses do not use this type of technology, then the chances of errors in their interventions are going to be much higher. But with the use of AI, you can actually reduce those error rates, right? Because think about this. Let's say triaging medical conditions from symptoms. There's just so many symptoms that a nurse alone or a nurse with just standard old workflow-based decision systems is not going to be accurate enough. Even in the US, when a nurse practitioner does, let's say in an urgent care clinic scenario, she does initial consultation, there are a lot of errors in that scenario, right? So by using AI, first of all, you can reduce those error rates. The second thing is by using AI, you can increase the productivity of those last mile workers. Because think about it, in our case, a nurse is now, with telehealth, she's doing a diet planning, which earlier could only be done by a dietitian, right? So you can do more protocols, you can increase the productivity, and plus you can reduce the error rates.
And so I'm curious, actually, this question for both of you, and I guess Joe will start with you, and then Shelley, move to you. You're both, very much kind of at the frontier of trying to create and improve what's possible to improve healthcare access, the quality of experience for the provider and the patient, and ultimately, improve health outcomes. And there is so much promise, Shelley, as you were just talking about, and actually emerging evidence of kind of what these new technologies make possible. And yet, of course, there are a number of risks, not only around patient safety, but also around patient privacy, or as I was talking yesterday with Tom Eaglesby of kind of the Biosecurity Institute at Johns Hopkins, also kind of to the data itself. So curious how you think about whether kind of patient safety or kind of better AI-enabled diagnostics, kind of these thorny questions around how to balance kind of improving access while protecting privacy, hopefully improving kind of the statistical robustness of the diagnostics without also kind of unintended, less than positive consequences, shall we say. How do you think about navigating that?
Well, I think, first of all, AI is just like any other tool. It could be used for good or bad. And I think there's more good to be done with it than bad. But as far as privacy is concerned, you can certainly encrypt patient data with this HIPAA compliance. If you're doing any kind of data transmission, it has to be encrypted. But the funny thing about privacy is people take it very seriously, but give it up so easily so they can find pizza near them. We've given up our privacy with our telephones. We don't mind, right? If you told us years ago that one day everything we're doing would get tracked, we would say, no way, we would never allow that. 1984. But now what do? We buy these smartphones and we totally allow them to look at everything we do. You just speak about something, it'll come up on your phone. So not that I'm saying we shouldn't be careful with privacy, but it's a responsibility of every individual to really put their money where their mouth is and demand that kind of privacy.
In our case, I think technology actually makes it easier to enforce privacy. So first of all, obviously, we follow HIPAA compliance, and we encrypt the data between the device and the cloud. And if, say, we were just using paper records, and we work on the last mile in low resource setting in, say, 17 plus states of India, it would be very hard for us to ensure privacy of those paper records and paper forms. Right? But this way, the data is on the device and in the cloud. It is fully protected in who can access it, how they can access it. So I would say technology usage actually helps in privacy rather than hinders it.
Well, and I think, Shelley, it's important, candidly, that leaders like you are so evidently thinking about questions relating to kind of privacy and kind of broader ethical considerations, because I think sometimes there's this conceit, shall we say, in kind of the wealthier world that somehow patient privacy matters less in low resource settings, and I fundamentally reject both that conceit and kind of the underlying presumptions. As you heard from RAGINA, there are lots of entrepreneurs, kind of innovators, ideators, all of the above in this room. And so I guess, as just a closing question to each of you, what advice do you have, either kind of to build on kind of what we've just talked about, kind of rooted in your work today, or what advice do you have from when you're both still young, but younger than you are now? What do you wish that someone maybe would have kind of told you or taught you or shown you? Truly, it's an open-ended question. Interpret it however feels most kind of resonant and urgent for what you would like them to hear.
I think there are two separate advices. One is on the technology side. If you are a care delivery company today, organization today, the use of tech in general and AI in particular can actually help you improve the quality of care. Don't be afraid of it. If you're just using nurses or health workers today, in especially LMIC scenarios, it would help you improve your quality of care. And advice on, in general side is that you have to pivot, you have to do a lot of experimentation while maintaining ethics in this field.
Joe?
I think if you have an idea that could improve the world, don't give up on it. Keep working on it. And also, don't worry about it. We're all going to die in 100 years, so don't take it too seriously. Just do your best.
Well, I feel like I need to maybe chime in so that we're not ending on the "don't worry, we're all gonna die" note, because while true, hopefully our mortality, which is inevitable, leads us just to work all the harder in whatever our purpose is. And while we all may need to maybe worry less, if the worry is counterproductive and claustrophobic, we also need to worry enough so that we have that restless energy to be in spaces and places like this, to find the right partners to help us fulfill our mission, which hopefully is at least in part about making the world a better place and the lives that we live on this planet more sustainable in the pursuit of kind of greater equity, justice, and joy. Let's end there. Thank you all so much.
That's what I meant.
Thank you for joining this session. Please make your way out of the room and refer to the app for other programming options.
All righty. I'm going to give another round of applause for our wonderful panelists. It is what we've all been waiting for. We're going to hear from our greenhouse pitchers, and I would love to welcome to the stage Mocha Lantum from Checkups Medical.
Good afternoon, ladies and gentlemen. First of all, on behalf of the entrepreneurs in the health equity pillar of CGI, I would like to say thank you for the support and for coming to this session. We are very used to hearing no's and very few yeses, and we believe the yeses are in the room. So I'd like to say, let's deliver, right? Exactly 25 years ago, on September 28th, 1998, President Nelson Mandela was on his last visit to the United States and honorably hosted by no other than President and Mrs. Clinton. And he left these last words: if our expectations, if our founders' prayers and dreams are unrealized, then we should all bear in mind that the greatest glory of living lies not in never falling, but in rising every time we fall. A quarter century later, perhaps we might ask, specific to health equity, have the expectations of Mandela, of the founding fathers of CGI and the founding mother been realized? The Africa I dream of is the Africa that belongs to that woman. In Swahili, Mama Mboga. She's the one who earns a living in the market stalls in the cities of Accra, Brazzaville, and Soweto. She's the one behind the kiosks in the busy streets of Lagos, Harare, and Yaoundé. She's the one working the factory lines, producing food, crops, and flowers for export in Kampala, Nairobi, and Addis Ababa. She's the informal worker. This is a woman who works to make ends meet. 6 to 7 days a week, her hands are tied to her inventory. Daily, she pays for food. Weekly, she pays her tithes. Monthly, she pays her rent. And quarterly, school fees, and the little that is left is for her fellow Mama Mboga who is in distress. Unfortunately, as it happens in 80% of households, every 4 weeks, illness strikes. Pay for consultation, $15. Pay for labs, $25. Pay for pharmacy, $35. Pay lump sum, pay now is the card she has been dealt. If we're in Monopoly, it's called go to jail. If it's in chess, it's checkmate. In real life, her cash flow is in peril. She's left with 3 options: delay care and stop working, and keep working, or borrow and pile on debt, or self-medicate and pray. Mama Mboga cannot access primary health care without undue hardship. And the promise of health equity is distant. And the pay now care barrier is the barrier we must bring down. $300 million informal workers paying $100 billion a year in either lost wages or in pay now care is the opportunity before us. Checkups has developed a health benefits management platform to help families and small businesses manage their health benefits in a manner tailored to their cash flow. For $2.50 paid 100 times, a family of 4 has access to health benefits for 365 days. It is convenient. That means accessible. It is affordable, not free. It's inclusive. 80% of the members are women, and all it takes to do is to have the ability to have a basin of tomatoes and a phone, and you can be on one of our health plans. It's good for the top line, it's good for the bottom line, but it is better for the triple bottom line. Our solution works this way. With a text or phone, our system is able to check for eligibility and available and your active status. Based on your benefits, the system escalates to a teleconsultation, and the doctor in charge is able to then now dispatch the nurse based on your location who is closest to the woman or the family. Lab samples are collected and the results sent to her phone, and medication delivered to her within 3 to 4 hours. The beauty is that for $250 paid in installments, pole pole, as we say, she has access to over $800 of benefits for herself and her family, including a full physical check for herself and her husband if he's around, and the children. $300,000 served, over 300 freelance nurses on the platform, 3x cheaper healthcare than the average market rate. I'd like somebody to say, the pay now care barrier is about to fall. Africa needs checkups, and checkups needs you. an investment in checkups. It's giving a shot at 300 million people having access to affordable care. It's an opportunity to create thousands of nurse jobs, and the carbon footprint is reduced when you take care to people. So now a solution that works for 80% of the informal workers requires us to have one singular duty, which is to unlock all channels, B2C, B2B2C, and B2G2C, and that is why we are excited to be here at CGI. So, ladies and gentlemen, we together can transform the way health insurance works for millions of people. Rise up to the expectations of Madiba. Rise up, and together we can bring down the pay now care barrier. Thank you very much.
Thank you so much. And next up, we have Avi Ambal of Dara Bio. Thank you.
Let's start. Good afternoon, everybody. Thank you for forsaking lunch to join us. Thank you. Quick show of hands. Do you know how many of you have either had a loved one go through cancer or lost one to cancer? There's a lot of hands here. Myself as well. The battle scars will show. So this is what we do. I'll come to the story in a minute. But the whole idea is to make cancer diagnostics. And the statistic, there's debates about whether early diagnosis leads to better outcomes, which we are on the side of, obviously. But the point is to try and bring about early diagnosis to reduce mortality and economic burden of cancers, which is what we're trying to do. This is a statistic. I'll not talk to you about the statistic because you've been through it. I have been through it myself. I had a growth in my throat 7 years back, and the reason I'm standing here, and not the slide you will see next, which is about the mortality statistics about later stage diagnosis versus early stage diagnosis, is largely because it's not accessible or affordable to most people. I was at a session yesterday when I was listening to Patrick Dempsey talking about Maine, and we're not talking about, sorry, apologies to Africa, but we're not talking about Malawi, but this is Maine, where half the population is about 60 minutes away from a doctor, or a 60-minute drive away from a doctor. So the accessibility issues that we see is what, there's some problem with the video, we tested this earlier, sorry about this. I'm just going to slip to the next. So that is what leads to the primary problems with early stage diagnosis with cancer. So what did we do? I'm a biomedical engineer by training. So we created, along with my grad school colleagues who went on to academia, we teamed up and we created this nanosensor coated thread. It's a tiny piece of thread. I don't know if everybody in the room can see it. The reason we brought that, I'll talk about later in the session, is that you spit on this, it detects biomarkers in saliva, non-genomic biomarkers, so you don't have to send it all the way to the lab, for oral and gastric cancer for now. So the whole reason then is that you can take it to, a phlebotomist can run this test somewhere in rural Maine, which I'll use as an example going through, and get the results on a companion app. We don't want to give the Joe public the ability to say, hey, you have cancer right away. But this makes early screening of cancer easier, affordable, and accessible, and all the good things that go with it. Before, obviously, I was talking to somebody else earlier in the audience, and this obviously has Ghosts of Theranos written all over it. Before you ask me the question, one, yay, I'm not blonde or beautiful, but that said, our research work on the science side has been funded by scientific due process by the agencies, so we don't have, I'm sorry to say this, not being political, but we don't have secretaries on our investment panel. We have the due process of the National Science Foundation that has funded the research. And more importantly, our work, the scientific work, has been published in Nature, which is the highest ranked peer-reviewed scientific research journal. So that gives us the credentials of what we've done in terms of bringing this to the lay audience. The key thing, and this is why I said I will talk about the thread later on, this nanosensor coated thread costs about 50 cents to make in the lab, which is thousands of degrees of magnitude cheaper than a conventional screen. We're not saying that this is going to be a replacement to the gold standard, but at the end of the day, if it makes this accessible at rural point of care, this is what we aim for. We say that it can reduce the disease burden significantly because the cost of screening is so much more lower. What we're looking for, obviously, being in a session like this with the adequate social capital around government, especially or regulatory, is to walk us through the process of getting an FDA exemption, because this is coming out of the body and this is nothing consumed inside it. So a 510K exemption, the pathways to that with obviously the clinical data. Second, I know on the judge's panel is the American College of Cardiology. Hopefully the American College of Oncology is here as well. So somebody like that to create the lobbying necessary to bring this to mainstream, because just over the weekend, USA Today broke a report that the incidence and prevalence of gastric cancers and oral cancers is rising among the young, that is the 30s. So that is me, that's my cue. So that's what we're here for. Thank you so much for your time, and looking forward to talking to you later. Thank you.
We're switching things up here. We're going to have another really great panel, and I'm actually going to announce some folks they're welcoming. There are illustrious judges. You see them over here taking copious amounts of notes. I'd love to welcome Charlie Hanna to the stage. Alexandra Peterson. Ibrahim Al-Husseini. And Dr. Ami Bhatt. We're, as Dr. Clinton noted, we're being gracious today, so I want to thank you so much for your time, continued engagement with us, and for being able to hear the great pitches that we have here on stage. I just have a couple of questions for you all. We'll see how many we get through. So first and foremost, can you all share about your work and how your work supports startups and values innovation? Whoever wants to go first, no pressure. Tiny bit of pressure, kidding.
I can start. My name is Charlie Hanna. I'm a principal at Marcy Venture Partners. The firm was co-founded by Jay-Z, Jay Brown, and Larry Marcus back in 2019. I've been with the fund since inception. We're a growth stage venture capital firm investing in consumer, culture, and positive impact. What does that mean? That's consumer products and services, broadly defined, but every startup that we invest in has to have elements of inclusivity, accessibility, sustainability, most relevant for this panel, health and wellness, and multiculturalism. We've invested in over 70% women and people of color as founders, not as a mandate per se, but if you want to build a successful company in the consumer space in the 21st century, you must have diversity on your founding team. It's also those positive impact values that I mentioned is where the largest share of consumer wallet are headed. I came from another panel prior to this about inclusivity and equity, and it really is about excellence and about success. You're not investing in these impact values because you're thinking about justice or giving out a favor. It's really about the financial case for investing and actually returning as much money to our LP as possible. So with that, I'll turn it over to you.
Good afternoon. I'm Alexandra Peterson. I'm the co-founder of Trophy Holdings. We support and invest in entrepreneurs that are in the health and food industries. We're 3 women. We came together to really share in our due diligence and leverage our networks to be strategic value to these businesses. We felt that it was incredibly important to represent more women in the investment world. As an example, only 2% of funds have exclusively led female teams. And so we like to come in and just show another lens to the investment world. In addition to that, we really look for businesses that are trying to make healthy living more affordable and accessible. We heard this morning from Cindy McCain and from President Clinton about the challenges around the food system in particular. I think some of the joys that we have is that we get to facilitate scalable solutions to some of these problems. We specialize in looking at businesses in the United States, generally between Series A through C, and we like to look at companies that are have a long-term vision that aren't trendy, but really trying to identify different problems and have a multitude of impact embedded in their business solutions.
Thank you.
Hi, everyone. I'm Brahim Al-Husseini. I've been a climate investor now for over 20 years. I invest out of 2 pools of capital. One is my family office, the Husseini Group. The other one, which is much more interesting, is called Full Cycle Climate Partners, which is a growth equity fund that I developed with my partners to accelerate the deployment of what we call climate critical technologies. This came out of over 20 years in the space that condenses the time frame of which we can all transition from a high carbon to a low carbon economy.
Hi, which one of these is not exactly like the other? So Dr. Ami Bhatt, nice to meet you all, Chief Innovation Officer at the American College of Cardiology. We represent 57,000 clinicians and members, 1/3 of whom are global, 2/3 in the United States. And we cover 43 countries where we have chapters or memberships. As a Chief Innovation Officer, the program started about 7 years ago. And originally they were looking at digital transformation, thinking someday it will come. So seed and Series A companies. And then the pandemic happened. And we realized that while it's very important to look at those early important companies, it's even more important to look at those who are doing innovation and care delivery, because we can't wait. Our patients cannot wait for better cardiovascular health, and our workforce has a significant shortage and can't wait for help either. And so we now really focus, while still looking at everything, on how to partner with companies that are in the scaling stage right now of improving access to high-quality cardiovascular care in the communities where people live. And then the second part of what we do is still some venture funding where we put a much smaller amount of money than these folks do, but really to be there on the cap table with these companies and say, look, we, the American College of Cardiology, think this is important, this is making a difference, and this is the kind of company that you should also support and also scale. Just to go back to what Joe said to Chelsea earlier, we talked about doctors and how they are with their patients. So I stopped practicing this year. I'm a cardiologist at Mass General Hospital and Harvard in Boston. And I will tell you that to me, every patient and family is my family. And that's still true. And so the opportunity we have here with all of you in the room is to recognize that every single person you're helping, and many of you are doing it at scale, they and their families are so grateful, and their clinicians are grateful because we can no longer do it alone. So thanks for having me.
Thank you. And one big question, so feel free to take it as you wish. We are in the health equity session, and so wondering what innovations in health equity and access are you seeing come into your spaces that really feel like they're going to move the needle?
Maybe I'll take that first.
Sure.
So I think there's 3 areas, right? So the first is we recognize that digital health, whether that is by way of smartphones, using a telephone, using a video visit, using remote monitoring, whether that's in the form of wearable or an actual device, that's incredibly important. And the technology is there. There's no question. The infrastructure of how to bring that information in, scan through it, and see when somebody is at risk, that is the area of growth that I'm most excited for. And I think people now understand that that's where we need to grow. So that's the first area. Two other areas, education. So really important to upskill community health workers. They are our future. They are the ones who are going to actually create a workforce because we need to treat ourselves in the community to an extent. And so I think that education needs to be pushed to kind of every corner of the world, and that's our responsibility. And the third is I'll touch on AI since we started there. There is AI that can make the administrative burden of healthcare better here in the United States, hands down. That's already happening. I should be able to talk to you and have a conversation, and the notes should be written. I shouldn't be facing my back to you typing at a computer, so we don't need to do that anymore. But I also think that that AI can tell me when somebody in the community is sick versus not sick, and can help us get the right people to the right care. And so although clinical decision-making and large AI systems will all be great right now, if we can just let clinicians concentrate on their patients, and if we can figure out who's sick and get them in sooner, those are probably the two most important parts of AI that need to be pushed right now.
Thank you. It's amazing.
I just want to pile on and to your first point. We're seeing a lot in the testing and personalization space, particularly saliva is one area that we're seeing, or urine or stool, and also particularly in women's health. So, taking these tests and then providing really clinical, analysis on hormones or menopause or different type of issues that people face, and then providing very personalized, specific treatments with vitamins, with supplements, with actual medication based on that test. So we're seeing hundreds of different startups innovating in the space. A lot of them have a lot of way to go, but there's a lot of innovation and a lot of money being poured into personalization and testing.
Awesome, I love it.
I'm going to climb back on for 1 second. 800 women a day die because of pregnancy and childbirth. And so those technologies that can look at the urine and tell us you are going to be at risk for a major cardiovascular event in your third trimester, we need to figure out how to get you from the community to a center when the time comes. Really important. So I love that you're investing in that area.
I agree with both of you, so perhaps I'll give some examples instead. So I think from the most rudimentary perspective, food is health, food is medicine, and so there's a company called EveryTable that's utilizing farm surplus food to create healthy meals that are priced per median income in the areas in which they're served. On the other side of the spectrum, there's a company called Spark Neuro, which is doing early detection for Alzheimer's and Parkinson's and other diseases.
We're investors in a company called Devoted Health, and their innovation is very simple: dignity. Like, their numbers are going through the roof year after year, and that's simply because they treat their patients with extreme care and dignity. And because of the numbers that are going through the healthcare system, at least in the US, and the insurance companies that keep trying to push costs down year after year, it's become a numbers game, and humanity is being pulled out of the equation, and these guys just had a completely different business model, and it's so nice to see them being able to meet their numbers so well just by providing, humanity and dignity to their patients.
It's amazing. And this is a big question, but, a last one. Where do you see the future of the industry going when it really comes to supporting health equity? Small boots.
I'll start. I think it's going to be more at home. I think we're going to be able to have so many of these amazing tests available to us through our wearables, through ordering in these tests, and then being able to take them and send them to a doctor, engage with AI. So I think that we won't we won't need to leave our homes so much, and particularly for those that don't have access to childcare or have jobs or multiple jobs. I think that's going to provide the most equity possible.
That's awesome.
What I'm seeing today, so this is definitely a question about the future, because today pricing, really matters, and access to these technologies, it's very expensive, and it's really reserved for this wealthy echelon of society, personalized health is really, not democratized yet. And so I see the future being, bringing the pricing of these products way down so that it's accessible and actually inclusive. We are not even close to there, but that would be the future, in my opinion.
I'm really, so I don't know the answer to your question, but I do know that I am enjoying watching the awareness around stress and physical activity become mainstream.
Absolutely.
And diet. We're coming out of this assumption that all the processed food and the packaged food and a sedentary lifestyle, we know what the consequences of that now are, and that awareness is really changing behavior on a mass scale. And I think because we live in the information age, that message gets out there much faster around the planet than it used to, and hopefully that becomes a standard. So we are doing what we need to do to remain vital and healthy and agile.
Absolutely. How many people are counting their steps? Everybody has it on their phone now. Very different than how many years ago. Yeah, absolutely.
I'm going to say it as a clinician. I think there's a culture change happening that's going to lead to equitable healthcare. We are going globally from paternalism to partnership and being responsible for your own care and partnering with those clinicians or the technologies and getting there. So I think we'll get there. If you look here at the U.S. And maybe just our Western approach to things, I would say the one thing we need to do is we need to stop calling it consumerism because it's patient agency. And I think as we make that change, going from consumerism, and that's a negative, to patient agency, wanting to know your steps, wanting to understand what your saliva shows because you know you have a family history of something, demanding that even though things are difficult, I live in a small village and I deserve health care, right? I think that's the difference. So I think that move from paternalistic to partnership, from consumerism to patient agency, that culture change, I think that's going to be the biggest difference for health equity.
I love that. Thank you all. And we're actually going to transition back into our pitches. So just another round of applause for our judges. Thank you. Y'all getting sick of me, yeah? Okay. We're going to welcome to the stage Dr. Blessing. I'm going to do it right. What is it? Animashan? Yeah. Dr. Blessing Animashan from Help Mum.
Yeah. Good afternoon. It's indeed a great honor and privilege to stand before you today. I'm Dr. Blessing Animashan, the Digital Innovation Lead at Help Mum Africa. Before I dive into my pitch, I want to ask a simple question. How many of us in this room have children? Kindly raise your hands. Great. How many of us have children beyond the age of 5 years? Oh, great. If I were to take this survey in my home country, Nigeria, especially in a remote rural community, I would have fewer hands raised. Sadly, some mothers have lost their children before the age of 5 due to vaccine-related deaths or diseases. Nigeria is one of the largest contributors to infant mortality in the world. It experiences the threatening loss of 2,300 deaths of children under the age of 5 every day. And the leading cause of this tragedy is vaccine-related deaths or diseases, often due to poverty and lack of knowledge. In Nigeria, a staggering 2.5 million children miss out on vital immunizations annually, making up to 30% of world's unimmunized children. It is stark reality. Let me introduce you to Mrs. Badejoko. We met her on the field during our early days at Help Mom. She lost her first child due to lack of access to healthcare delivery service and tools. And she has not even taken her other children for immunization because she does not understand the importance and lacks the financial means to do so. There are millions of Mrs. Badejoko in remote rural communities in Nigeria facing the same challenges, ultimately leading to high infant mortality rate due to vaccine-related deaths or diseases. Our solution: we harness the power of digital innovation to tackle these problems head-on. Our first digital innovation tool, the Help Mom Vaccination Tracker, was developed to address the issue of immunization record keeping in Nigeria. In Nigeria, the government relies on paper cards for immunization records, making tracking a monumental challenge. The Help Mom Vaccination Tracker Reminder digitally registers nursing mothers across all areas in Nigeria. And we have over 100,000 nursing mothers currently enrolled. It sends reminders to them in their preferred language to take their child for immunization. But we later realized that reminders alone were not enough. And that was where our advanced artificial intelligence tool comes into play, the Help Mom Advisor. It was developed in partnership with Vanderbilt University and Google Research. The Help Mom Advisor analyzed data from the Help Mom Vaccination Tracker Reminder. It predicts barriers to immunization and tailors intervention to increase the likelihood of each nursing mother taking up their child for immunization. Our traction and impact. In 2019 to 2022, we had 45% improved immunization outcome with the use of the Help Mom Vaccination Tracker. In January to June 2023, we had 73% improved immunization outcome when the Help Mom Advisor was incorporated with the Help Mom Vaccination Tracker. Our path to scale: we want to scale further. We want the government to adopt the Help Mom Vaccination Tracker and the Help Mom Advisor to enhance immunization outcome. In Nigeria, we have 36 state governments plus the Federal Capital Territory. 2 state governments have adopted the Help Mom Vaccination Tracker and the Help Mom Advisor to improve immunization outcome in this region. We are in early discussion with the federal government of Nigeria to adopt the Help Mom Vaccination Tracker and the Help Mom Advisor to be able to impact a potential of 10 million children annually. Google, Facebook, World Connect, Global Citizen, Leap Africa, and other international organizations have been our steadfast partner for years. In closing, I want to leave you with this profound African saying that it takes a village to raise a child. Today, we invite every individual in this room to come together and extend their support towards our mission of helping nursing mothers in Nigeria prevent vaccine-related death or diseases, and helping Nigerian children to grow beyond the age of 5. Together, we can make a life-changing impact. Thank you.
And can we welcome to the stage Nikki Ben with LifeNet International.
Good afternoon, everybody. I've worked in humanitarian aid, international development for about 30 years now, and I have been immeasurably blessed to meet and work with some incredible people who are doing incredible transformational things. But during that time, I've also witnessed a huge amount of harm and heartache and tragedy. And although I'm extremely privileged to do what I do, I'm very much aware of that. It's that tragedy that continues to keep me and LifeNet doing what we do every day. Running on a theme, over 900,000 mothers and babies die each year across sub-Saharan Africa from preventable diseases, from preventable causes. Preventable causes. And these statistics on the screen are shocking to me, they're shocking to LifeNet, and I hope they're shocking to you. And I want to be here to remind you that behind every single one of these numbers are people. And alluding a little bit to the panel earlier, this is about dignity and respect. People that are not afforded dignity and respect and access to the quality of healthcare that they deserve. So it was with this mission and this intention to help people access quality healthcare that LifeNet was founded in 2009 as a social enterprise, a social franchise model. After a few years of prototyping, we launched in Burundi in 2012. We currently work across 6 countries in sub-Saharan Africa with 410 health facilities. Now you'll see here, we work through faith-based health facilities. And why? Because they provide an average of 40% of all healthcare across sub-Saharan Africa. And yet they are critically under-resourced, often forgotten, both by the public and private sector. And they clearly provide incredibly important community services that are outside of healthcare as well. So the LifeNet model is really straightforward, actually. We leverage local assets, so we use the human and social capital that already exists in those health facilities. We present a suite of services to those franchisees, robust medical training. We link health facilities to state-of-the-art equipment, pharmaceutical supplies. And then we also provide contextually appropriate management training. These are private businesses, and they require support to be able to be sustainable and thrive. That training takes about 3.5 years, which at that point the health facilities move into an alumni program where LifeNet continues to give continuous quality improvement and assessment work. The impact's significant. At just less than $1 per patient visit. In that 10 years since we launched in Burundi, the partner health facilities have seen 32 million patients with improved care. Just in 2022 alone, 160,000 safe labour and deliveries happened by midwives who attended because they had been part of the LifeNet model. Like, these are great statistics, but there is so much more to do. So for us, we're contributing to a resilient health system in any of the countries in which we partner. Resilience for us is about coping capacities. It's about making sure that those health facilities can withstand the shocks and stresses, whether they're financial, political, economic, social, environmental. We want to be part of that health system strengthening. We're applying a market development approach, a business approach in what are typically last mile, inequitable, and often broken systems. And whilst, yes, we're tracking inputs and activities, actually what we're really focused on are impact outcomes. And for us, number of lives saved is what we're tracking. And for LifeNet, outcomes don't get much better than that. So the way ahead for us, we're sort of focusing on 3 areas. Research, and I suspect I speak for a lot of people in this room, it's still critically underfunded, but so significantly important. So we want to continue with our research to understand where we can invest better. Innovation for us, as I say, we're using a market development approach in kind of broken systems. How's that going to work? How do we take this franchise model and make it work? How do we take the business sector? How do we take the private sector partnerships and make them work in those last mile locations? We also want to be in 100% of faith-based health facilities that will benefit and be able to use the LifeNet model and save more lives. But we also want to scale vertically. We want to look at digital health, connectivity, water and sanitation. How do we use telehealth in those last mile locations? There's a lot of vertical support that we can do to the LifeNet model, so there's infinitely more to come. I want to invite you to join us in any way that you can on that journey. Because you know, the heart of CGI is about a call to action. We've heard that over the last couple of days. And really, the heart of the mission of LifeNet is a call to change. And I know that I don't want to be standing here this time next year having the same conversations and these numbers aren't coming down. So please join us in any way you can and help us save more lives. Thank you.
I'd love to welcome to the stage Ida Sarah of Maisha Package.
Good afternoon, everyone. I'm very thankful for everyone who joined us today, and I'm very grateful for CAG to give us this platform. My name is Ida Joseph Saera. I'm the co-founder and CEO of Maisha Package, or Life Package. Maisha is a Swahili word which means life. And I'm going to share a very short story of Maisha Package. So Maisha Package started 2017, and I started when I was still a college student. And this started when I came across the data about teenager pregnancy in Tanzania. And apart from teenager pregnancies, Tanzania faces challenges to adolescent girls in accessing safe and affordable menstrual products. So the main challenge was teenager pregnancies. It's increasing because of lack of sexual and reproductive health, which are friends' informations because of culture and taboos. Most of adolescents access this information from themselves. I remember when I was in second year college, one of my roommates stated to me that, Ida, if you don't want to get pregnant, if you have a sex and after sex you drink cold water, you are not going to get pregnant. So that imagine that is a college student who is about 20 years is telling me that. What about adolescents who are aged 15 to 19 who are in rural areas? So we started a mission of. Sorry, we're going to use this one instead. Oh, okay.
Go ahead and hold the mic.
Okay. So we started a mission of educating adolescents using a package. And because there is a challenge of accessing menstrual hygiene facilities, which makes young girls to miss school for about 3 to 4 days in a month because they lack access to proper menstrual tools. We combined these challenges together, and we formed the Maisha package. This is a small package that contains reusable sanitary pads and disposable sanitary pads, including sexual reproductive health information with a contact to experts who can provide adolescents a friend access and a friend information according to their age. And while learning these packages and selling, then the pandemic happened, and it really got us bad. But while focusing on it, I came with a new idea of helping teenagers, mothers, and out-of-school girls. Because in Tanzania, if you get pregnant and you are still a student, you are not going to you are not going back to school after you do delivery. So I set a new platform, and this is a new one for Maisha package. It's give support to out-of-school girls and adolescents as mothers. I equip them with sexual reproductive health informations by giving them a training from expertise. But also, I equip them on how to make reusable sanitary pads so that they can be affordable for adolescents and they can ensure that they are safe. Because when you don't have a safe for during menstruation, when you don't have safe sanitary pads, most of girls got infection, including urinary tract diseases. So I give this platform to these adolescent mothers. I equip them, I give them the facilities, including a starter pack, including sewing machines. They are making these reusable sanitary pads. I buy it from them, I do packaging, and I sell it out for stakeholders, mostly NGOs. And our main partner for this project have been UNFPA Tanzania, UN Women, UNICEF. And I was really glad to see TF, Tony Lumelo Foundation COE yesterday, and I was one of the beneficiaries from it. So for now, I would like to welcome all of you to be part of this successful mini project. on ensuring that girls do not miss school when they are menstruating by having an accessible, safe menstrual pack, but as well as to ensure that adolescents get access to friends, sexual reproductive health so that to alleviate teenager pregnancy in Tanzania, while we give platform to adolescent mothers and out-of-school girls, a place that they can work and improve their economic and be independent. Thank you.
We would love to welcome to the stage Lorraine Maluka of Malaika.
Thank you very much. Good afternoon, everyone. My name is Dr. Lorraine Muluka. I'm an OBGYN from Nairobi, Kenya, and co-founder and CEO of Malaika. Malaika is a maternal health startup that is committed to making the pregnancy journey safe for millions of pregnant women. And the problem we're looking at has been mentioned severally today, but it bears being mentioned again. Looking at this, you can see the clear disparity in terms of the maternal mortality ratio in sub-Saharan Africa and in Europe. We can see we're having moms losing their lives 600 times more than what it is in Europe. And from the conversations that have been going on, we realize that even here in the US, the figures could be much better. The problem this big, having been in the maternal health space, I have gotten to experience a number of these deaths, and one that is really close to me and actually spurred me starting Malaika was of a lady who was in the 8th month of her pregnancy. And this was her 3rd baby. And she realizes at some point that she's not feeling the baby moving. And so after some time, she decides to go to a facility that's close by. An ultrasound is done, and unfortunately, she finds out that she had lost the baby. She then has to go to hospital for delivery, but when she gets there, she's now convulsing. She was discovered to have eclampsia, a complication of high blood pressure in pregnancy, and had to undergo surgery, but at this point, her organs had failed. And unfortunately, she did not survive. The lady I speak of was my cousin. And this is just one of the many stories of the mothers who actually lose their lives during a period of time when they're bringing life to the world. At Malaika, we are committed to changing this. We want to change the current fragmented touch points in the pregnancy journey, whereby mothers are having delays in seeking care, delays in getting to the right facilities, and delays in receiving the right care when they get to these hospitals. So leveraging on technology, we are using smartphones to connect pregnant women to their own personal nurse midwives. Via WhatsApp, they're able to chat with them, ask any questions that they may have, but most importantly, these nurse midwives are here to ensure that the mothers are adhering to the WHO guidelines. They're actually having their visits as they should have. They're actually having the right tests that they should have at the right time. We are also building communities of pregnant mothers. So via WhatsApp, we put the moms in the same trimesters together, and here we're able to educate them, bringing in different specialists to address different issues about pregnancies, really increasing their knowledge about danger signs in pregnancies and what to do. And then not being left behind in the age of AI, we're actually utilizing this to be able to support our nurse midwives to give better care, to be able to actually have a better reach for mothers, being able to translate educational content into different languages. And this enables us to be scalable and get to a point of financial sustainability. We are ambitious, and our goal is to build a social unicorn, whereby we can generate impact for these mothers and babies. We can create attractive jobs for nurse midwives, and we can also have shareholder value. We know we cannot do this on our own. And to get there, what do we need? We need to have more partnerships. There are people in this room who are interested in health equity, and so we're here to partner with you. Would like additional investments for us to actually get to this goal. So if you're here and this is a space that you're interested in, Please, let's have a conversation and join us in making these journeys safe for mothers and their babies. Thank you.
We'd love to welcome to the stage Gina Klein. Regina Klein? Either one. Okay, Regina Klein. We love her, Regina, founder of Smart Job.
How's everybody doing? Wake up, wake up. I'm Gina Klein. I'm the managing partner and founder of Enable Ventures. We're the first impact venture capital firm in the world to invest to close the disability wealth gap. And we're an ecosystem builder and scout through our company, Smart Job. Globally, there are over 1 billion people with disabilities. Here in the US, that's 1 in 5 adults. 26% of adults in the United States have some type of disability. And yet, nearly 2/3 of the world's working age people with disabilities are not employed. That's an economic crisis of epic proportions that should be talked about more, and it's not yet. And yet, we're changing this by investing in and growing the disability innovation sector and ecosystem across the world, by backing founders and makers, working with the disability community, people who are creating solutions to barriers in their own lives. We view disability as an asset that can unlock countless untapped economic potential through products and services that are powered by inclusive and universal design. A year ago, I stood here at CGI on the stage in a commitment to action, announcing a moonshot effort, working with the disability innovation ecosystem across the world, 10 disability technology accelerators in 6 countries, working collegially and together towards a goal of dramatically growing and materially growing the disability innovation ecosystem across the world. And I am very proud to share on behalf of our partners across the world today that we received philanthropic support from JP Chase on this historic moonshot project. And we're announcing today the release of the world's first report on the global state of disability innovation and its technological ecosystem. It's a landscape review. Thank you. A landscape review of innovation hubs around the world, of accelerators and entrepreneurial support organizations. We have spent tireless efforts coordinating great leaders across the world. One of them's here in the audience, Rosalie Tim from CSD. But there are leaders like Rosalie across the world who are leading entire innovation sectors, who are now coordinated in a historic effort in partnership with Smart Job and Village Capital to shine a light, particularly through this report that we released today, on the truly untapped economic potential of disability. There is an untapped potential to grow an inclusive and universally designed technology market, one that puts people at its heart, that values as an asset human-centered design, and shows us where opportunities lie to grow, support, and fund this ecosystem in the years ahead. This is a call to action in a movement. Find out more about what we're doing at smartjob.net, the Village Capital site, and in our Moonshot partners. Find us on LinkedIn, find our Moonshot partners, and tune in to what disability innovators are doing across the world. We thank the Clinton Global Initiative for your stage and for your community. Thank you.
And next, we would love to welcome to the stage Sam Warwick of Next Step Health.
Thank you. Thank you. Hi, everybody. My name is Sam Warwick. I'm the founder and CEO of Next Step Health. Recently, the Surgeon General of the United States underscored the importance and the fact that the increase of mental health needs amongst our youth is the defining public health crisis of our time, and that youth mental health has taken a hit as social media use occurs more often and at younger ages. In the report, there was some data cited that about 20% of teens are almost constantly using social media platforms like TikTok, Snapchat, Instagram, and YouTube. And at the same time, 7 in 10 teens are experiencing a mental health challenge. If you work in education or in the field of mental health, you're not surprised by these statistics. I started working in this field and launched my company, Next Step Health, to honor the memory of my brother who passed away in 2008 from a prescription drug interaction. When this happened, I realized that I had to navigate through this grief, and so I began my own journey to take the next step for resilience. And I realized that mental health education, prevention, and early intervention needed a new operating system. So I got to work designing and developing new initiatives to support individuals and communities to cultivate resilience. And I began this journey while I was studying at the University of New Hampshire. While I was there, I got some early support from the National Science Foundation as a young innovator. I then became a fellow at Stanford University's Hasso-Plattner Institute of Design, and I'm now wrapping up grad school at Harvard. But this is our resilience cultivation ecosystem today. So in the box with the blue to green gradient, you'll see our Next Step Good Life platform, which is intentionally designed to look and feel like these social media apps where many of our teens are almost constantly using. But under the hood, it's an evidence-based mental health resilience cultivation platform that provides educational media and skills-based lesson modules alongside a suite of other personal health management tools and check-ins for goals, sleep, and emotions that provide insight into how teens are doing throughout their day. One of the things we do with this is we provide users with access to their data in a very easy to understand and digest format so they can draw their own correlations between how they're feeling and why they're feeling certain ways, the sleep they're getting, the goals they're achieving. And this is really, to inform them about their own health. In the background, we also use this data to inform our early identification and intervention for mental health conditions. So if a user is identified as being potentially at risk or potentially in need of support, we can then refer them to mental health treatment. In addition, we have our own mental health treatment platform where we have partner health and social service providers so we can really streamline that process. Both of these platforms, Next Step Good Life and nextstep.health, are available on the App Store and Google Play if you'd like to check them out. Here's a little bit more about how we bridge prevention and treatment. And we do that through the early identification and intervention for those mental health conditions. So on the left-hand side of the screen, you'll see the Next Step Good Life app. Here, you can see a user is using a mood check-in, and they've identified and indicated that they're stressed. So because of this indication, this button is conditionally rendered, asking them if they need mental health support. And if they tap that button, they'll be able to access different crisis response initiatives like the crisis text line, 988 suicide hotline, and our nextstep.health platform. We're really excited and launching very soon real-time support capabilities with AI. So stay posted with us and we'll let you know when that comes out. So I invite you to join us in our mission today. If you're a capital partner, we'd love to have you to invest to further develop our prevention, early identification, and intervention technologies to support the prevention of mental health challenges and suicidality amongst teens. We're also seeking implementation partners if you're from the public sector or the private sector if you work in CSR. We've partnered with folks in all these sectors and would love to join you. Also today, we're announcing the My Next Step campaign. So we've got some great early partners and storytellers, including activists and athletes like Big Papi David Ortiz, who's a Hall of Fame baseball player from the Red Sox, for those of you who may not be from here or not baseball fans. I've got actor and film producer Elijah Wood, who you may know as Frodo from Lord of the Rings, and rapper and music producer Juicy J. Some of our clients, partners, and supporters include the New York City Office of the Mayor, the State of New Hampshire Department of Education, AmeriHealth Caritas, which is a health insurance company and managed care organization in 13 states across the US, Verizon, New York City EDC, Harvard Innovation Labs, Microsoft, VentureWell, and Big Brothers Big Sisters are also supporters. Also, just last month, Next Step and I were acknowledged by Forbes for their 30 Under 30 publication series. Anyway, if you'd like to get in touch, please send me a message. My email is sam@nextstep.health, and our website is nextstephealth.com. And I appreciate you bearing with me. These were not the final slides. Thank you.
We'd love to welcome Ava Mwai of North Star Alliance to the stage.
Good afternoon, everyone. My name is Eva Mwai, as you've heard, and I want to give you a little story about truck drivers. Many of truck drivers, not many people hear about them, but this is what it is. One driver alone in the jungle with a long truck. Insecurity, no access to health, no access to anything, and this person is a human being, can get ill. So what happens after that? In 2006, down in Malawi, Southern Africa, TNT Transport Logistics Company and the UNWFP were transporting food to drought-stricken places. And when they were doing so, 2 years down the line, they realized that HIV was actually devastating truck drivers. Their numbers were reducing and reducing. And so North Star Alliance was born then. This organization provides quality health care to mobile workers like truck drivers and the communities that they interact with. And who do they interact with? The sex workers, because of the nature of their work, and the transit towns where they get to park, and the traders and other people, along the corridors. So you look at those pictures, usually that's how the place looks like. And why is this work important? As more and more people cross borders for work, recreation, or even safety, the risk of disease spreading from country to country grows. And the spread of disease is a threat to the industry and also to public health in general. The truck drivers face a lot of problems. And how North Star does this, how we address this problem, is by remodeling shipping containers into clinics, which we place in strategic places along the transport corridors, especially where truck drivers park, cross-border places, transit towns, and ports. And in those places, there's a lot of sex work and informal trade. Each of the blue box clinic, that's what we call them, has flexible opening hours tailored to meet the needs of the local clients. And sometimes we find ourselves working late in the night and sometimes 24 hours if it so demands. We have an electronic system which transports information from one clinic to the other real time to ensure that there is quality of health care. We offer different kinds of services, HIV prevention and treatment. We initiate ARVs in our clinics, tuberculosis screening. You can imagine any infectious disease. If a truck driver comes with a bag from one corner of the continent to the other, that disease will spread not just to the people that they meet on a day-to-day basis, but also to their families. So we do a lot of those things, including non-communicable diseases management and behavior change. Looking at our data in 2022, 633 people pass through our clinics. And what we do, if it's TB, HIV, or any other infectious disease, we follow them up by phone, by everything possible to ensure that they complete medication and live healthy lives. That's for their own benefit. And out of doing that, we also monitor very closely how we do the UN 95-95-95 goals. Last year alone, we achieved 94% viral suppression among the people who were HIV positive and taking their medication. This is what we are planning to do. We want to integrate laboratories and telemedicine in 10 of our clinics. The reason is truck drivers in the jungle, far away on their own, far from public healthcare system. How do they get the investigations done unless in our clinics when they come there? And we also want to increase our clinics by 13 of them by 2027 in our strategic plan. The reason is DRC, Southern Sudan, because of the problems that are there, Ethiopia, they require this help, the transport corridors passing across those countries. And we use very little money to do this. I believe if we join hands, we can get this to happen. So join us to make the transport corridors in Africa safer and healthier for trade facilitation, for economic growth. Thank you. There's my contact. See you.
Alrighty, and we have our last greenhouse participant, Shelly Saxena. You saw him earlier on the panel from Save a Mob.
So I have the unique honor of closing out the greenhouse pitches. Thanks to the CGI team. Hi, I'm Shelly from Save a Mob. We are a US-based company with a subsidiary in India. And the main pain point which we address is that underserved areas have a scarcity of medical staff and diagnostic services. As you guys know, this increases the cost of treatment, increases delays, and oftentimes even leads to death. And we address this pain point via an AI-assisted disease management platform. The platform has two components. One is AI-based triage, consult, and point-of-care screening. And second is health outcome delivery via telehealth and on-site pop-up clinics or mobile clinics. And by integrating these two, we enable delivery of interventions ranging from general health to vision, nutrition, cardiometabolic, and infectious disease at up to 50% lower cost. So Save a Mob AI is currently a bastardized term. Everybody is a .ai these days, but we are really doing AI. So first of all, our AI can work offline in a lower source setting. It can be used by a nurse or a health worker with minimal training, and we have 4 patents pending on this AI. Our symptoms AI can predict medical conditions from symptoms. Our diet AI can predict multivitamin and mineral deficiencies and recommend a diet plan. Our sputum AI can screen for tuberculosis. Our blood AI can screen for anemia, and our vision AI can screen for diabetic retinopathy. And the list of conditions here is just the starting point. Just on blood alone, with additional funding, we can add support for more than 50 different conditions over time. So our business model is B2B, and our target customers are employers, corporate CSR, health insurance companies, pharmaceuticals, NGOs, and local government agencies. There are 2 revenue streams. One, we charge for tech licensing on a software as a service model. And second is we charge for health outcome delivery on $1 per day or $1 per patient per month or $1 per patient model. And last 12 months, we did around $2 million in revenue with an EBITDA of around 5 to 6% for a company at our stage with money going into R&D. Having an EBITDA positive company is really noteworthy. And we currently are serving 116 plus B2B customers in 17 plus states of India. We have also done pilots in Southern Africa and in the US markets. So some of the results of our intervention, last quarter we did average of 100,000 plus patient consults per month, up to 50% reduction in cost of primary care, and we have published the results of these studies, up to 15% reduction in malnutrition in select groups, up to 25% reduction in vision issues in select groups, and then early detection and treatment of diseases like tuberculosis, malaria, and COVID. During COVID, our recovery rates was over 88.1%. So far, we have raised $1.8 million in equity, primarily from US-based impact investors. Some of our investors include WillCap Investments, ADAP Capital, Sorensen Impact, Artha Ventures, and so on and so forth. And we have raised $200,000 in debt from Caspian, and we have actually paid off the first tranche completely of that debt. So we are raising $4 million in equity or a hybrid funding model. The use of funds is going to be to expand the AI portfolio and to expand our coverage area, both inside India as well as outside, by using franchisees and resellers. And potential exit for the company is acquisition by a healthcare clinic chain, a diagnostic chain, a pharmacy chain, and we already have strategic partnerships with some of these potential acquirers down the road. Also, if you are a foundation, let's partner on specific interventions which are of interest to you. You pay us only if we deliver a health outcome. For example, we just signed a contract with USAID where they will pay us only if we find a TB patient and we do the 6 months treatment compliance on that patient and do nutrition support on that patient. If we cannot deliver that, we don't get paid. So whatever is your intervention of choice, whether that is malnutrition or vision or infectious disease, we pay if we deliver. Thank you.
Alrighty, I want to, for the folks left in the room, I know people had to go to the next session. Just a huge round of applause to our Greenhouse participants. Y'all did an amazing job. This does conclude our Greenhouse programming. We will not actually be announcing on the stage. I believe there's going to be a press release and an announcement that comes to let you all know what's going on. Of course, we will communicate to you internally what's going on, but I want to also say a huge thank you to our judges, with all of you for giving your time and expertise to support them and kind of help us make this happen. And thank you all so much. Feel free to hop on and we will see you later. Thank you.
Thank
For
you.
sure. What?
Thank
This
you.
is awesome.
Please
Y'all are
make
great.
your-
Yeah, thank you.
Thank you for joining this session. Please make your way out of the room and refer to the app for other programming options.
Take it from me. Malay, don't grow on trees, no. Don't let the money